So hello everyone, I'm Dr. Sarthak Patel and I scored 213 marks in FMG June 2022.
Hello, this is Dr. Bharat Patel. I scored 207 in recent FMG June 2022. And we both graduated from David Villani Medical University. And today we have brought for you a fun and interesting video. Hope you will all kind of enjoy it too.
So it is a kind of rapid fire round, and what we are going to do in this game is we'll ask each other a 10 question, and each question will carrying a 1 marks, and who will get the higher will win this game. So are you ready, Dr. Bharat?
Yes, I am ready and I'll ask the first question.
Sure.
Okay, so you have a 30-second to answer the question. And the first question is 50-year-old patient that present to you with the progressive dyspnea for 1 year and on HRCT basal reticular pattern with area of honeycomb is seen. So what is the most probable diagnosis?
So as we mentioned, in the HRCT there is a honeycombing pattern, and patient also has a dyspnea. So it is a straightforward the interstitial pneumonia, I think.
Yes, it is interstitial pneumonia. I think I gave more time to answer. I think I had to give some less.
No. So it's now my turn. A 55-year-old man present to you with a 2-week history of pain in his hand. The pain is particularly bad in his right hand. On examination, brown discoloration of his nails with oncholysis, and the distal interphalangeal joints are swollen and tender. What will be the probable diagnosis? Your time starts now.
Right. So the patient has asymmetric involvement of the joint and also involvement of the distal phalanges, right?
Right.
And there is some also nail changes. So it is arthritis, kind of arthritis. I think it's psoriatic arthritis, I guess.
Yeah, it is psoriatic arthritis. You're right.
Yes. So now next question. Patient present to you with to the emergency department with a history of short-lasting episode of behavior changes and unresponsive in which he is agitated, accompanied by smacking of the lips and the thrashing movement of his limbs. On recovery, patient is not able to recall the episode. What do you think it is a diagnosis?
So all the symptoms are related to the seizure, I think, right?
सीजर तो है, कौन सा सीजर particularly? इतना सोचने की जरूरत ही नहीं है इसमें, I guess.
Think it's a temporal lobe epilepsy. Temporal.
तुक्का मारा या पता था?
नहीं पता था क्या तुक्का मारा.
Yes. और दूसरा नाम है इसका temporal epilepsy.
वो नहीं पता.
Partial seizure it is. Okay. Yeah. Still you are right, I guess. It is temporal lobe epilepsy.
So now it's my turn. In a child with a tetralogy of Fallot, with a fever and diarrhea, what is the surest sign of cyanotic spell? To make it more easier, I'll give you options. A. Hepatomegaly. B. Absence of murmur. C. S3 gallop. Or D. SpO2 less than 75%. You have 30 seconds to answer.
It's not an easy question. I'm not able to recall, but I can say I can rule out the two options, that is hepatomegaly and S3 gallop. And बाकी जो बचे उसमें से I'm not sure, but it is absence of murmur. I'm guessing it just.
Yes, it is absence of murmur. चलो तुम्हारी बारी.
Okay, ये थोड़ा tricky है question. ज़्यादा clinically oriented. Okay, so 66-year-old man present with complaint of nausea and a decrease in appetite for 4 to 6 weeks. His serum calcium is 7.8 mg per dl. Serum albumin is 2 mg per dl. Serum creatinine is 1.2 mg per dl. And so yeah, that's it. And what is the following most appropriate response?
Can you repeat the lab value again?
Okay, so his serum calcium is 7.8 mg per dl, serum albumin is 2 mg per dl, and serum creatinine is 1.2 mg per dl. What is the most appropriate response?
All the labs value seems pretty normal.
What is the response there? You only have 30 seconds. Hurry up.
तो सभी ठीक है, नहीं
So
नहीं आता,
नहीं आ रहा. चलो.
नहीं आता,
There is no further response needed.
इतना सिंपल
Also
था
not that. हाँ, it's not that difficult.
बे
इतना
यार।
इजी खेला था, मैंने वो एक्सपेक्ट नहीं किया था तुमसे एटलीस्ट.
लेकिन मुझे क्या पता कि इतना ट्रिकी होगा। चल कोई नहीं।
चलो.
नेक्स्ट क्वेश्चन, इट्स फ्रॉम द रेडियोलॉजी। A patient present with a headache and seizure, what will be the radiological feature which suggests epidermoid cyst of the brain?
Particularly that suggests epidermal cyst.
Radiological feature.
उतना कुछ ज्यादा आता नहीं है रेडियोलॉजी में, याद भी नहीं आ रहा है तो.
स्किप किया होगा ना रेडियो तो।
नहीं, कुछ ज्यादा पढ़ा नहीं था. आई थिंक आई एम नॉट एबल टू रिकॉल. नो. नहीं. क्या है?
It's high signal on diffusion weighted MRI.
ओह.
ये थोड़ा टफ था ये थोड़ा।
कोई नहीं, तेरा भी
कोई
एक
नहीं,
गलत हुआ, मेरा भी एक हुआ.
1-1।
चलो.
नेक्स्ट।
नेक्स्ट अभी चलो मैं पूछता हूँ. अभी ये तो इजी है, फॉरेंसिक मेडिसिन से पूछता हूँ. चलो. Patient brought to the casualty with greenish color skin and rotten egg odor. So, what is the most poisonous product used by the patient?
ऑप्शन
ऑप्शन
मिलेगा क्या?
चाहिए ये? हाँ, मैं वो पूछ रहा था. ऑप्शन चल दिखा देता हूँ. फर्स्ट साइनाइड, सेकंड कार्बन मोनोऑक्साइड, थर्ड हाइड्रोजन सल्फाइड और लास्ट नाइट्राइट. अभी तो आना चाहिए, तो ऑप्शन तो इजी थे. एक.
आता याद आ गया, हाइड्रोजन सल्फाइड।
हाँ, ये तो तू गलत करता ना तो मैं पूछता ही नहीं आगे कोई क्वेश्चन अभी.
इसका बहुत रट्टा मारा था।
हाँ. ये तो
याद आ
पीवाई
जाए।
की है, बहुत बहुत पूछते हैं एफएमजी में ये.
बहुत बहुत बार एफएमजी में आता है ये।
चलो नेक्स्ट.
Yeah. So next, a 25-year-old female of fertile nulliparous is started on bromocriptine therapy for macroprolactinoma. After a month of her therapy, her prolactin level is found to be 40 micrograms. Next best step in management would be
सो स्टार्टेड ऑन ब्रोमोक्रिप्टिन ऑलरेडी.
already yes
लेवल क्या है उसका प्रोलैक्टिन का?
40.
40. आई थिंक ब्रोमोक्रिप्टिन नहीं कंटिन्यू था. आई एम नॉट श्योर. वही होगा शायद. ब्रोमोक्रिप्टिन कंटिन्यू. तो
ब्रोमोक्रिप्टिन कंटिन्यू करेंगे लेकिन उसका डोज बढ़ा के, यू हैव टू इंक्रीज द डोज ऑफ द ब्रोमोक्रिप्टिन, सो यू आर रॉन्ग।
सो इस हाफ नहीं
2-1।
मिलेगा इसका?
नहीं 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 नहीं, ऐसे कैसे हाथ मिलेगा?
कोई नहीं,
गलत।
चलो.
नेक्स्ट
मैं
वन।
भी थोड़ा ट्राई करता हूँ थोड़ा क्वेश्चन पूछने. चलो ठीक. A middle-aged female with polyarthritis and oral ulcer and dryness of eyes. She is found to have elevated rheumatic factor and ANA levels also. She is also positive for anti-U1-RNP. So what is the diagnosis? ये तो difficult है ही नहीं actually, straightforward ही है. What is the diagnosis?
So as you mentioned in the question also, she is positive for the anti-U1 RNP. So it's pretty straightforward. It's mixed
Uh,
connective tissue disorder, MCTD है।
yeah. Yes,
तो
it is
इसी का।
MCTD mix का. ये हमने साथ में पढ़ा था याद होगा अगर.
हाँ साथ में ही पढ़ा था, ये इजी था। So
चलो.
the next one, a 30-year-old male presented with a hemoptysis and RPGN. He is a smoker and does not give a history of previous similar episode. Renal biopsy reveals linear Ig deposit in GBM. The most likely finding on serology is antibody against. किसके अगेंस्ट एंटीबॉडी मिलेगी?
ये आई थिंक इजी है, उतना डिफिकल्ट नहीं ये. मतलब पहले तो देख डायग्नोसिस, आई थिंक इट इज गुड पास्चर, राइट?
वो तो है गुड पास्चर, ये तो सिंपल था। एंटीबॉडी
किसके
किसके
अगेंस्ट
अगेंस्ट मिलेगी?
एंटीबॉडी? आई थिंक इट इज अल्फा 3 सब यूनिट ऑफ टाइप 4 कोलेजन. एम आई राइट?
अल्फा 3 और अल्फा 4।
नहीं, रुक. नहीं, अल्फा 3 है. अल्फा 3 सब यूनिट ऑफ टाइप 4 कोलेजन.
पक्का?
शायद यही याद आ रहा है, यही होगा शायद, यही है। अल्फा 3 होगा, अल्फा 3 सब यूनिट ऑफ टाइप 4 कोलेजन।
सही है,
हाँ।
राइट। अल्फा 3 सब यूनिट ऑफ टाइप 4 कोलेजन। मैं सिर्फ कंफ्यूज करना चाह रहा था लेकिन हुआ नहीं। गुड वन, गुड वन।
ओके, चलो नेक्स्ट वन फॉर यू।
हम्म
19-year-old boy suffering from chronic schizophrenia is put on haloperidol in dose of 20 mg per day. Okay, so next question for you. A 19-year-old boy suffering from chronic schizophrenia is put on haloperidol in the dose of 20 mg per day. A week after initiation of medication, the patient show restlessness and irritability. So what is the most appropriate treatment strategy? Your time start now. You have 30 seconds.
ये थोड़ा टफ है, याद नहीं आ रहा है इसके बारे में कुछ।
Time is running. Jaldi. 15,
हालो पेरिडोल।
10, 5,
नहीं नहीं नहीं, नहीं
10.
आता, नहीं आता।
ओके, तेरा दूसरा गलत। ये था एडिशन ऑफ बीटा ब्लॉकर आंसर इसका।
एडिशन ऑफ बीटा ब्लॉकर।
यस।
कोई नहीं। नेक्स्ट वन।
ओके।
45-year-old male came to the psychiatric OPD complaining of a continuous, dull, non-progressive headache. The patient has seen numerous neurologists in belief that he has brain tumor and requested yet another workup. All investigations were normal. The most probable diagnosis. साइकेट्री का क्वेश्चन है।
आई थिंक ये इजी वन है बिकॉज सारे टिपिकल फीचर दिए हुए हैं। पेशेंट सीन न्यूमरस डॉक्टर्स एंड all the investigation are normal, so they are the feature of hypochondriasis.
हाइपोकॉन्ड्रियासिस, करेक्ट, सही है।
Yeah.
नेक्स्ट वन।
Okay, तो तूने इजी पूछा तो मैं भी थोड़ा इजी पूछता हूँ। A 45-year-old man who was chronic alcoholic presented with the confusion, ataxia, and diplopia. So, what is the treatment protocol? Simple.
तो सिंपल है, we should start him first on the vitamin B1 and then followed by the glucose infusion.
आंसर सही है। डायग्नोसिस नहीं बताया तूने, बता दे फिर भी। इजी है तो।
वर्निक है।
एकदम इजी था ये।
इजी था ये तो।
चलो नेक्स्ट।
Next one. A 27-year-old man with a 2-year history of left-sided ulcerative colitis is hospitalized for a flare of disease. He has been receiving corticosteroid intravenously for 3 days without much of a therapeutic response. The most appropriate therapeutic plan for him.
So, patient with ulcerative colitis flare up. I think then we have to start off the patient with the immunosuppressant, right?
Which one?
This cyclosporine,
Cyclosporine.
IV cyclosporine.
Cyclosporine it is.
Yes.
Next.
अभी चलो pediatric का question. 5-year-old child with confusion, fever, and feature of sepsis with a blood pressure of 90/60, pulse rate of 144 per minute, and a respiratory rate of 30 per minute. What is the initial fluid of choice for the management? Bolo.
Child initial fluid of choice, I know it should be normal saline.
कितना normal saline amount and याद दिला दो, सिर्फ 15 सेकंड ही बाकी। Okay, so next question for you from pediatrics. Okay, so 5-year-old child with continuous fever and the feature of sepsis with a blood pressure of 90/60, pulse rate of 144 per minute, and a respiratory rate of 30. What is the initial fluid of choice for the management?
Initial fluid of choice, I know it should be a normal saline for child.
अमाउंट एंड याद दिला तो 15 सेकंड ही बाकी कितने अमाउंट
अमाउंट भी बताना होगा.
यस यू हैव टू 10 सेकंड
Amount, I'm not sure about the amount.
it is
I know it.
20 it is 20 and time is up because I'm saying the answer 20 ml per kg. You got it wrong.
No problem.
So you
Okay,
got your
so
third question, all right?
now it's my turn. 43-year-old man is homozygous for a C2A2Y. The serum iron level is 220 mg per dl. Percentage saturation is 88% and ferritin is 575 microgram per liter. Liver tests are normal. Physical examination findings are normal. What would you recommend it? It's very easy.
Yeah, I think it is because patient has C2A2Y
C2Y.
homozygous,
Hmm.
right? And what is the level of iron and ferritin you said?
Iron level 220 mg per dl and ferritin 575 microgram per liter.
Yeah, it is then hemochromatosis, I guess. And the best treatment it is phlebotomy, right?
Phlebotomy. बोला था easy है तो.
It is easy, right? Thank you.
Next one.
Okay. The next one is a 20-year-old woman present with bilateral conductive deafness and palpable purpura on the legs and hemoptysis. Radiograph of the chest show thin wall cavity in the left lower zone, and investigation reveal a total leukocyte count of 12,000 per mm cube. Cell cast in the urine and serum creatinine is 3 mg per dl. What is the diagnosis? AB is easy, straightforward. Okay, so next question. 20-year-old woman present with the bilateral conductive deafness, palpable purpura on the legs, and hemoptysis. Radiograph of the chest show thin wall cavity in the left lower zone, and investigation revealed the leukocyte count of 12,000 per mm cube. In the urine, cell cast is seen, and serum creatinine is 3 mg per dl. What is the diagnosis?
In the question, I think most of the organ system are involved. I think lungs are involved, also the upper respiratory tract and all. Multi-system involvement. So yes, I think it is a vasculitis.
Yes, it is a vasculitis. Which kind of?
In the vasculitis, I guess it is Wegener's granulomatosis.
Yes,
is it?
You are right. It is a Wegener granulomatosis.
Wegener granulomatosis. Right. Now it's my turn. A 32-year-old man present to emergency with a 1-day history of pain in the right knee. On the examination, the right knee is swollen, warm, and extremely painful on movement. What is the most appropriate step in management? Medicine का straightforward question है.
Management पूछा, right? तो the symptom में है कि joint is warm and tender. Right, so and it is acute episode, so it is acute septic arthritis. So we have to aspirate the joint and blood culture, followed by with appropriate antibiotic, right? Yes, it is straightforward.
Your turn.
Okay, so last question, and this is from one of my favorite subjects, OBGY. Okay, so during a labor, patient is diagnosed with deep transverse arrest. On examination, fetal heart is normal, and the mid pelvis seems contracted with the prominent ischial spine. What is the most appropriate management? Easy, ekdam easy.
In this case, the most appropriate management to CSE हो सकता है. C-section.
C-section. इतना easy question पूछा मैंने.
So the last one is from mine. 38-year-old Gravida 1 present for a routine visit at 39 weeks gestation. Her blood pressure is persistently 140/90 mmHg, and her urine protein is 2. Her cervix is 2 cm dilated and 90% effaced, with a fetal vertex at 0 station. what is the next step? This one is from your favorite subject.
I was expecting a difficult question, but it was easy. Like, blood pressure is elevated, protein is 2 plus, and she is in 39 week of gestation. So we have to induce the labor. It's straight. We have to induce.
Straightforward. सही है. So I guess we have the winner. Congratulations, Dr. Bharat.
Thank you, Dr. Sarthak. So in the end, we would just like to say a few words about our journey here. We kind of studying together in our school days, and we also did the medicine from the same school, and he's one of my best friends too.
So as you can say that we know each other since 10 years now, and we have been in each other's ups and downs also. And I'm really glad that I can share this experience with you. And I hope that we can both succeed in our future endeavors. So all the best, Dr. Bharat.
Thank you. And you too, Dr. Sarthak.
Thank you so much.